Good afternoon, everyone. My name is Kris Ritualo. I'm a certified aging in place specialist. I'm also a senior state and community engagement specialist for AARP California. Today, we're going to have a little bit of a conversation or a chat about caregivers and the person that they're caring for. Now, caregivers comprise all aspects of life. AARP Family Caregivers, their mission is to support family caregivers where they are at home or in the workforce. As we all know, AARP is a nonprofit, nonpartisan organization that empowers people to choose how they live as they age. AARP is striving to make it easier for older adults to live independently by providing planning resources and additional forms of support to family caregivers. Today, we are going to have a conversation. We're going to learn about the 5 steps to create a caregiving plan. We're going to connect, if we have some caregivers here, we're going to connect with each other and to share tips and information and learn about resources available to you. Nearly everything we'll be addressing today is from AARP's Prepare to Care guide. Now, Prepare to Care resources guides are designed to help develop and implement a caregiving plan for a loved one or a friend. Now, you can find this guide simply by visiting aarp.org and just search for Prepare to Care. Now, Prepare to Care guide is available in, of course, in English, Chinese, and Spanish. I think we are now in the middle of making this or preparing this to make sure that it's also available in Mandarin. This edition is also available for the LGBTQ+ community, as well as for the veterans, the service members, and their families. Now, to help you get a picture of today's family caregiver, think of the time that you did the following. So I'm going to imagine that I'm going to throw a ball at you, a red ball. So every time I ask you this question, think of it as a red ball and just keep holding to a different balls every time you think you're doing it. Now, if you have ever helped a loved one with household tasks, such as cleaning, doing laundry, or doing any yard work, you get a red ball. If you've ever helped them with their medication, you get 2 balls. If you have regularly cook or provide food or do ordering for them through Uber Eats, do you get another ball? So now you have 3 balls with you. Now, do you also drive them to the doctor's appointment? Do you make shopping trips for them or run other errands? Do you help them with their finances or pay their bills? Now, as you can imagine, all of these tasks take on added layers of complication given our current public health emergency. As we all know, we're still in the middle of pandemic. So all of this we have to think about to make sure we're staying safe. Now, outside of this many tasks that we do as a family caregiver, many of us are still currently also working, okay? So today I'm going to share practical information to help you care for your loved ones while also best caring for yourself. We're going to talk about starting the conversation, forming your team, making a plan to care for somebody that you love, finding the support that you need as a caregiver, and lastly, my favorite of them all, of course, is called caring for yourself. Now, let's talk about really quickly about starting the conversation. Now, many people wait until a crisis occurs before they talk about their values and preferences. Just a quick reminder, please, if you have any questions, so please feel free to unmute yourself or utilize the chat room and we can help you with your questions. Now, Many folks, as I mentioned earlier, wait until the crisis occurs. So that we need to talk about their wishes for the health care or details about their finances. It really is never easy to bring up what you think will be a very uncomfortable topic. However, a lot of uncertainty can be avoided if you talk with your loved ones before the crisis occurs. Now, before you start a conversation, here are some tips to consider. Look for an opening. Now, when raising the topic of future care, you might find it very helpful to reference an article you just read. For example, you might say, I just read something on ACC's website referencing about finances or learning how to work with your finances. Maybe someday you can show me where you put your finances together. Now, try not to anticipate what your loved one might say or how they will react. Just get the conversation going. Be open, express your love and concern, and most importantly, listen. Keep in mind that the conversation will likely take place over time. Number two, respecting your loved one's wishes. Every family caregiving plan must center on the wishes of the person receiving the care. A plan should never be made without the participation, without the knowledge and the consent of your loved ones. Once you have started the conversation, you may want to bring in few other trusted family or friends to be part of the process. Now, before meeting, you and other family members should consider who is the best person to start or lead the conversation. What are your feelings and outlook on the situation? What are your goals, or what is the best outcome you think might happen? What are you prepared and not prepared to do? What is the most difficult for you about having this conversation about the person you are caring about? Let's talk about sizing up the situation first. Once you get the conversation going, evaluate what you're sharing, what you're hearing, I should say. Understand your loved one's priorities, where they want to live, where do they want to live, and the nature of their care will really help you figure out the next steps. Now, hearing all this information will really help you or will really lead you to find the resources that you need. Feel free to ask questions in the chat room if you have any questions. Now, let's talk about really quickly about finances, reviewing your finances. Money can be a very particularly sensitive subject to talk about, particularly in the Asian community where I was raised. Money is not something we talk about, but that's conversation that's really, really important. One thing that family caregivers often find surprising is that most health insurance, including Medicare, pays for a little bit, if any, of the cost of care in a nursing home, assisted living, or help with daily activities such as dressing or meals. Now, you have to consider how you're going to pay for housing, pay for healthcare and other expenses such as your groceries, your medications, your transportations. Now, ask your loved ones to review their bank accounts, their investments, their insurance coverage, and other relevant finances, their assets, their incomes that can really be used to cover this cost. Find out if they have long-term care insurance should they need it. Now, this is one of the things that we oftentimes encounter. It's called the counter resistance. Their initial response usually says, they always say, I just don't want to talk about it, which is really prominent, once again, in the Asian community. Now, keep in mind that some people are very private by nature. Sometimes it's very difficult for someone to admit they need help. And as a result, you may encounter some resistance. Now, if your first conversation doesn't go very well, keep trying. Start small, discuss just one aspect of your concerns. You can start about, hey, let's talk about finance today, or let's talk about mortgage, or let's talk about Xfinity today, or something that's really simple, and then start there. Now, if you're still running into difficulty, try asking a trusted friend, a doctor, or a faith leader, or people or folks in ACC. I'm sure you have somebody in ACC that you can talk to. Now, there are some tips to forming your team. So in starting to form your team, here are some few basic goals to consider. How many team members should you aim for? Now, in building your team, remember to balance quantity and quality, but most importantly, how to best satisfy the needs of your loved ones. While having a large caregiving team can be very helpful, too many people might be too much. We always know that sometimes it's too many voices. So we might look for a little bit of smaller team, but a very effective quality team. Now make sure everyone is clear about their responsibilities. They should be very supportive and willing to lend a hand, both to you and to your loved ones. If you're not the lead of the team, make sure that you are part of the support to the leader of the team. Everyone has something to contribute. Play to each person's strengths, and we're going to talk about that in a little bit, about the different strengths that you can utilize during caregiving. Now, remind all team members to stay focused on the care recipient. And I mentioned this many times in the beginning, that always focus the care to the recipient, okay? Now, if you live nearby and can help with simple tasks, we always know that proximity certainly has really some important advantages, such as stopping over to see your loved ones, driving them to a doctor's appointment, or cooking them a meal. However, living nearby is not a prerequisite to be on your loved one's caregiving team. They could be in San Diego and they could still be part of your caregiving team. And of course, technology has really helped bridge that gap of many caregivers, like utilizing Zoom calls, like what we're doing right now. Maybe you can have that every week. Or somebody who's really good at technology can be the one that can order all their medications, or order food, order groceries. Now, share their talents. Leverage the talents and strengths of your team. Now, for example, the computer whiz in the family could really set up an online calendar for coordinating meals or chores. And someone who loves to garden might be willing to really help out on your loved one's yard. We have any questions? Nothing yet. Okay, good. Now let's talk about making a plan. Now, the most effective family caregiving plans are made with the person, once again, you are caring for, at the center of the discussion. With all this information that you've gathered through going through your goals in the checklist, you can begin to explore the options available in the community and bring in team members to help manage the workload. Now, maybe by now you have an idea who are your caregivers on your team. It is now time to figure out the plan. Be sure to ask your caregiving team members about their preferences for who does what task, what work, what are they want to do. The plan doesn't have to be very extensive. You can never anticipate or every scenario. The plan should include immediate needs as well as plans for the future. Now, keep in mind that the options for addressing the needs will depend, of course, with finances, the willingness of the support of your team, and the resources available in the community. Now, first thing what we want to do is holding a team meeting. Start by holding the team meeting, and like I mentioned earlier, many of us have already lots of practice holding virtual team meetings right now, such as the Zoom. But the second thing that we need to do is assess the goals and needs of your caregiving plan. Remember, once again, this does not have to be extensive, as you cannot anticipate, once again, the different scenarios that will happen. And I mentioned earlier, make sure to include the immediate needs and, of course, the plans for the future. If you ever have a chance, if you have the Prepare to Care guide, it's on page 23 and 33. There is an assessment of goals and needs. So if you ever need a guide, please reach out to me or to Danny, and she will reach out to me for how many numbers of Prepare to Care guide I can send them. Now, here are some helpful tips to remember during your team meeting. Remember, once again, to include the person who will receive the care. Always remember that they are always going to be the center of the conversation. Keep everyone informed of the plan. Taking notes would really help, or if you're in Zoom calls, record it, because that's really, really important, because you can always go back, hey, I forgot what I'm supposed to do. Hey, I forgot what time I'm supposed to log in. Those are the things that you really need to have. And keep a summary, a written summary if possible, of the plan to really help ensure that the wishes and needs of your loved ones have been considered and, of course, included. We're going to step 4, which is finding the support. Now, if you've come to realize that earlier we talked about those red balls where it starts to grow pretty soon, it's too much for you to hold to the point where it starts falling down. That means think of it as your task. Pretty soon it's too much as they start falling down. Now, if you've come to realize that it is too much for you to handle, what you really need to do is to find the support. If it's too much, look out or reach out to the organization in your community for help. Now, here are some tips to finding a support. Locate community resources. A variety of support services are available to people and their caregivers throughout, of course, United States, wherever you are. Now, your local area agency on aging can typically help connect you to services such as the home delivered meals, transportation, adult daycare centers, care management, and more. What really impressed me with ACC is that they have all this information, all these resources for caregivers. So reach out to ACC for resources, and they can always reach out. ACC can always reach out to other organizations if they need more information. Consulting a professional. Oftentimes, your loved one's needs can be very complex, especially when your health, the emotion, and the financial issues are at play. Now, a trained social worker or a nurse can really help you sort things out. They can also help you in finding services, then also arrange for care. Again, the elder care locator is a great resource to find for many professionals. So I believe in by calling in not 911, but rather 211 is another resource that you can call for many of the resources. So if you call 211, please connect me to a resource for a caregiver. So use those numbers if you ever need some help or support from a resource organization. Hiring an assistant. If you see that your loved one needs help with daily activities, you can explore the range of home care services that are available to you. Some home workers do housekeeping, some do meal prep, laundry, and shopping. Others provide more hands-on with bath base, dressing, transferring from one position to another, which usually requires special training, a license or certification, depending on the law. So make sure you have, if you ever get to the point where you start looking um, for someone to help you with the help, I should say, make sure you always check for their license, check their backgrounds, and of course, the cost. Secure safety. Now, the main goal is to help your loved ones stay as independent as possible, and of course, in their own home. Now, as your loved one has more difficulty getting around or their vision or hearing fades, some simple changes can be made to make the home safer. Handrails, grab bars, night lights, and adjustable shower seats. Hold on, sorry. And adjustable shower seats can make a house safer and more comfortable. I'm not sure if you're familiar, if for those of us who probably will need help financially, Rebuilding Together actually has support or can help you install grab bars or even handrails for your home from low cost to free actually. So you can reach out to Rebuilding Together if you need those help. Now, if your loved one has decided that they would prefer to get care in a new residence that combine housing with support services, you can look in the variety of housing options that may be available in your community. Once again, ACC is a great resource for that. But be sure to begin by making a list of criteria such as location, group dining, laundry services, and more. Now, once you know the type of living arrangement, visit several facilities. Oh my goodness. And be sure to talk with residents and their families. My my allergies are really bad today for some reason. Now, caring for yourself. My favorite part of caregiving, of course, is caring for yourself. Now, don't overlook the impact of caregiving. Balancing caregiving with work if you're still working or with your family obligation. This is really, really stressful for many of us. You know, I have a volunteer who was working, who was also caring for his dad and also married with children. And he said he wished at those times when he was doing it that he knew all about this. Always pay attention to your health and your well-being. Now, the best way to ensure you have the energy to care for a loved one is to take care of yourself. Like they always say, a car cannot run on an empty tank or a low battery. Right now, the gas are getting so expensive. So make sure your car the tank is always full. So because that really, imagine that that's your energy to run that car. So you make sure you have that energy to take care of someone. We've talked about earlier about caregiving from a distance. So make sure you utilize the technology, um, such as personal emergency response systems. I actually have a camera in my home. I don't have anyone that I'm actually caring for right now, but I have camera in a home that I use for, I have a tiny little dog that I actually talk to her every day, like at 12 noon. I remind her to go use the bathroom and she goes outside to use the bathroom. So technology really is very, very helpful. For those of us who are still working, caring for somebody that you love is really, really difficult. Now make sure to find out if your company has policies or programs to support caregivers. Benefits or services may be available that can help ease your situation. Advocate for yourself. Let your loved ones' doctors know that you are their primary caregiver, and your information on their condition, on the treatments prescribed, you need to know all of those. Make sure you ask their doctor that about the information on their condition. Now, the CARE Act, I'm not sure if you're familiar with the CARE Act. It's called the CARE Act, or the Caregiver Advice Record Enable, which has passed in many states recently, generally requires hospital to provide your loved ones the opportunity to designate a family caregiver when admitted. It's supposed to inform you when your loved one is to be discharged to another facility or back home. CARE Act gives you explanation and live instruction of the medical tasks, such as medication management, wound care. So remember the word live instruction. Make sure you get the live instruction. Sometimes many of the patients, they'll say, here you go home, read this paper about instruction on how to turn somebody in bed when they're in bed. Make sure they show you live. Always remember to recognize your emotions. How you came into the role as a caregiver can really influence you feel about the experience. Perhaps you have always been close to the person that you're caring for, or really this is a chance for you to give in return in the loving care that they have shown you or given you. Lastly, take care of yourself. Allow yourself to take a break, tend to your own needs for exercise, sleep, and healthy eating. Find a way to reduce your stress and make sure to take time to have fun. If you have the time to care, if you take the time, I should say, to take care of yourself, you often return to your responsibility really renewed and better able to provide care for your loved ones. You know, I'm always looking at ACC's classes that they offer. They offer so much fun stuff in ACC, how to play ukulele. They have virtual workshops recently on cooking, so which is really, really great. And a lot of educational information on fraud. So make sure you take advantage of those classes or workshops being offered by ACC. Here are some resources for caregivers. The most important one that you can really look at is the Caregiving Resource Line, which is 1-877-333-5885. So this one really serves both AARP members and non-members alike. Also, like I mentioned earlier, the California Aging and Adult Information Line, which is 211, which this information line links individuals and caregivers to local aging and caregiver services, and coordinates a wide array of services for seniors, for adults with disabilities, and caregivers at the community level. It also serves as the focal point for local aging concerns. So 211 outside of 911 is a very important number to know. Lastly, Alzheimer's station at 800-272-3900. And just a little bit of a demographic on Alzheimer's. There are about 2.3 million Californians directly affected by Alzheimer's, either living with the disease or caring for a loved one who suffers from Alzheimer's. That's a lot. That's huge, big number. So we have come to the end of our presentation. We talked about starting the 5 steps to creating a plan, starting the conversation, forming your team, making a plan, finding the support, 211, and of course, caring for yourself. The most important part of the whole thing is really, really caring for yourself. Not once, you need to do this oftentimes, at least once a week. Always care for yourself. That's all I have today. And we have come to the end of our presentation today. So please, if you have any questions, unmute yourself, or maybe ACC can help vet those questions. Danny?
Hi, Kris. Thank you. Yes, if anyone has any questions, please do leave it in the chat box, or you can also email them later to Sean and myself, and we can shoot them over to Kris as well.
Yes. And if you're really interested for the Prepare to Care, here it is. This is one of the Prepare to Care guide. And if you need one of this, please reach out to them, and then they can find out how many numbers you need, and we can always email them to or mail them to you. It's actually also available online if you're interested to look at them. The best thing about this Caregiver Resource Guide is it has all this personal information checklist. We talked about that earlier, that the checklist is really, really important to have. It'll ask you for the insurance policy number, homeowner's insurance agent, when are the garbage going to be picked up, what days. When I first moved into my home, I don't know what days my garbage are picked up until I saw all my neighbors bringing their stuff in to the front. So those are the good things to know. Simple things, but great things to know. Any other? I think we're good. So thank you so much for joining us today. I hope you can join us again next time. I'm sure, Danny, we are doing some more educational workshops in the future.
Yes, we plan to have Kris back every quarter if she'll have us. So
and hopefully my allergies will be better next time.
I hope so too, Kris.
I was choking.
Yeah, you poor thing.
Like, no, is that COVID?
I know. Thank you so much, Kris, for being here. Thank you, everybody.
Thank you. Have a good day. Bye-bye.
Have a good day.